Well, good morning, everyone. I call this hearing to order and a quorum is present. Without objection, the chair is authorized to declare a recess at any time. I want to welcome all the members and the witnesses to today's hearing. I know that members have participated in similar virtual hearings this year with the full committee, but just a few reminders about the rules of the road so that we have an engaging experience here today. If you're experiencing connectivity issues, make sure you or your staff contact our designated technical supports so those issues can be resolved immediately. And to ensure that our member participants today can have robust engagement, I ask that members participating remotely continue to remain visible on camera for the duration of their participation in the hearing, unless they have issues or other technical problems that render them unable to fully participate on camera. Today, we'll be using a virtual timer to keep time. To keep that timer in your view, select grid or focus view. If you put your mouse over the second thumbnail from the right and click on the white circle and select lock participant, that will be held in place for you. When you are recognized, you'll need to unmute your microphone and pause for just a couple of seconds before speaking so that your words are captured in their entirety on the live stream. If you wish to have a document inserted into the record, please ask for unanimous consent and have your staff email the document to veteransaffairs.hearings@mail.house.gov. It'll be uploaded to the committee document repository. Are there any questions from members about procedures for the hearing? Well, hearing none, we'll proceed. I ask unanimous consent that Representative Spanberger be permitted to join today's hearing so that she can speak about relevant workforce issues in her district if she's able to join us. Without objection. I now recognize myself for an opening statement. In this Oversight and Investigation Subcommittee hearing, we're going to be discussing a high priority question. Is the Department of Veterans Affairs doing enough to ensure workforce diversity, equity, and inclusion? I've heard too often examples of VA employees experiencing racism and other discrimination at VA facilities. I've also seen too many media stories from across the nation where some of the agency's hospitals and other facilities seem blind to the problems. And too often the employee feels helpless in their appeals to facility management if they report their experience at all. With more than 400,000 employees and contractors, VA faces the tall task of ensuring that hundreds of facilities are each taking the necessary steps to promote diverse, inclusive, and equitable workplaces that are also free of discrimination and harassment. However, this must always remain one of the highest priorities for the department and for Congress. Let's start looking at some of the numbers. At first glance, VA's workforce is diverse as nearly 43% of employees are non-white and about 61% are female as of late 2020. However, upon closer examination, the numbers paint a concerning picture. According to VA data, most minorities and women are significantly underrepresented in VA's most senior job roles. Black or African American females comprise almost 17% of VA workforce, but less than 6% of the most senior career positions. By comparison, white males comprise only 23% of the VA workforce, but make up nearly 50% of VA's most senior career positions. Further, Hispanic employees are underrepresented at VA, hired at a lower rate, and have a higher involuntary separation rate when compared to the relevant non-VA labor force. In 2020, VA employees from facilities across the country filed over 2,800 formal EEO complaints, and these complaints are filed by employees who have experienced discrimination based on their race, color, religion, sex, pregnancy, sexual orientation, gender identity, national origin, age, disability, or genetic information. Of course, it's not just about the numbers, because behind each complaint is a person worthy of the department's and this committee's attention. These conditions have persisted for too long within the agency. There are longstanding laws that require federal agencies to address workplace barriers and employee complaints by identifying their root causes. At VA, we must go beyond just understanding the sources of inequity. We must do something proactive about them. Unfortunately, many of the solutions were not a priority in the past. It's clear from official reports that VA officials identified the solution and sought more staff and funding, but those requests went unfulfilled. VA also had to pause its established diversity and inclusion training program due to the former president's executive order. Today's hearing comes 86 days since Secretary McDonough has been sworn in. He has stated forcefully and many times that it is important to have a diverse and inclusive workforce at VA. This is a welcome symbol of progress, and Secretary McDonough has also established a 120-day inclusion, diversity, equity, and access task force to help design and implement an integrated set of initiatives. I applaud this step, and I know that more can and should be done without delay. Last month, full committee chair Mark Takano and I wrote to Secretary McDonough asking VA to analyze multiple workforce barriers that have stymied more inclusion and diversity for years. We also identified other specific steps that the Secretary could approve to make a difference in the coming months. To be honest, I was disappointed we didn't receive a promise to make those steps or others into near-term priorities. We simply can't afford to repeat the mistakes of the last administration that left key VA offices understaffed and ill-equipped to adequately support and protect VA employees. I hope to hear how VA plans to address all the longstanding workforce barriers to inclusion, diversity, and equity as soon as possible. And I look forward to discussing how VA is working at the national and local levels to train all supervisors and employees, institute industry best practices, leverage partnerships with employee and community stakeholder groups, and better utilize data to ensure every employee at every facility is valued, treated fairly, and respected. Organizational and cultural change takes years, especially for a large enterprise like VA, but it's imperative that VA demonstrates progress in building a more diverse, inclusive, and equitable workplace. This will result in a stronger workforce and ultimately better care for veterans. I look forward to our witnesses' testimony and discussing how all of us can be part of this positive change. And with that, I'd like to recognize Ranking Member Mann for 5 minutes for any opening remarks he may wish to make.
Yeah, well, thank you, Chairman Pappas, and thank you for your leadership and having this hearing and shedding light on this important issue. I'm pleased to be here today to discuss the important topic of diversity and inclusion within the VA's workforce. I do hope in the future we can find a way to hold important hearings like this one in person with the proper safety protocols in place. I know we all know that we lose much of the interaction that can happen between witnesses and members in this virtual environment. And I look forward to working with you, Mr. Chairman, to make in-person hearings a reality as soon as we can. Moving on to today's topic, I agree with all of our witnesses that ensuring diversity among VA's workforce is critical to the department's mission. More importantly, I want to unequivocally state that there's no place for discrimination or racism at VA. Discrimination and racism are the antithesis of the American values that our veterans fought to defend, and they should never be tolerated. My experience in the private sector has taught me that employees bring their diverse life experiences and expertise to the workforce. That is a positive thing that can make the workforce better. We should be celebrating and encouraging diversity, not ignoring or belittling it. When it comes to hiring and promoting individuals, I think we all believe that the best person for the job should get the job. However, VA can and should do more to prepare and invest in candidates for minority populations to set them up for success. We need to look beyond algorithms and statistics to show how investing in these candidates not only gives them another tool for success, but in turn advances the department's mission to provide timely and quality health care and benefits to veterans from all walks of life. I'm interested in learning today how VA intends to improve diversity and inclusion within the department specifically, tangibly, and measurably. I expect to hear about real actions, and I'm interested to hear how VA will measure the success of these initiatives and their impact on the delivery of care of benefits to veterans. I'm also interested in hearing VA's response to the many serious allegations raised at AFG's testimony. As I said earlier, there should be zero tolerance for discrimination at VA. I look forward to hearing from AFGE about how they believe progress is or is not being made to address the issues they've raised in the media at medical centers in Kansas City, Dublin, Georgia, and others. I'm pleased that we will also be hearing from Rick Wade from the U.S. Chamber of Commerce about how a more diverse workforce can deliver a better product to the customer, in this case, the veteran. I've always been a firm believer that government agencies should leverage innovative strategies from the private sector, and I look forward to Mr. Wade's views on how VA can do just that. I also appreciate Mr. Wade's focus on individuals. As he said in previous testimony before Congress, programs and goals that work in a city may not work in rural areas like my district in Kansas. VA needs to have the flexibility to focus on the individuals they hire, promote, and develop. As policymakers, we should avoid broad legislation and blanket goals that may work in some parts of the country but fail in others. Lastly, equal employment opportunity complaints at VA are too high and take a significant amount of time to address. This leaves the employee without resolution or faith in the system, which degrades performance and the service the veterans have received. That's why I'm proud to co-sponsor HR 2788, the VA Equal Employment Opportunity Counselor Modernization Act with Representative Connor Lamb of Pennsylvania. This bill would lift an arbitrary cap on the number of EEO counselors, which should help VA address and resolve informal conflicts faster and better before they escalate to formal complaints. Once again, Mr. Chairman, I thank you for holding this important hearing and look forward to the discussion. I yield back.
Well, thank you, Ranking Member Mann. And we're also joined by Full Committee Chair Mark Takano. I'd like to turn it over to him for 5 minutes for opening comments.
Well, thank you, Chairman Pappas and Ranking Member Mann and the rest of the subcommittee for holding this very important hearing today. Coincidentally, this hearing happens to fall during Public Service Recognition Week at VA, where the department is celebrating the diversity and resilience of VA's workforce. I, too, salute the over 400,000 employees that work tirelessly each year to serve our nation's veterans and their families. This is especially true during the COVID-19 pandemic. My deepest thank you to all of you. Now, while we recognize the many strengths of VA's workforce, today's testimony will show that we still have a long road ahead to create a VA that is welcoming for all. Sadly, some basic steps required by VA leadership remain incomplete. Year in and year out, VA has reported in its annual Equal Employment Opportunity assessments that barriers exist for many in VA's workforce. Sometimes this is an issue of race, sometimes gender. It can be barriers that exist for peoples with disabilities, or due to age or sexual orientation. And for too long, VA has failed to take enough action to understand and address these unfair, discriminatory, and damaging barriers for far too many of its employees. For example, VA has a diversity problem in its most senior ranks. With an organization as large and decentralized as VA, diversity among these senior leaders is critical. The people in these roles should not only set the right tone at VA on workforce issues, but should also exemplify VA's commitment to hiring, retaining, and promoting workers of all backgrounds. Now, the Secretary and I agree on the importance of making real change in VA's culture, and I have hope for the future of VA under his leadership. But there is a lot of urgent work to do. To start, the Secretary must take the necessary steps to repair and rebuild the trust of veterans and VA employees that serve them. During the previous administration, VA targeted whistleblowers for retaliation, questioned and diminished survivors of sexual harassment and assault, expressed hostility towards organized labor, failed to act swiftly to prevent racial discrimination, and obstructed Congress's oversight efforts. Despite these setbacks, we have a new opportunity to make real progress. I'm heartened, frankly, that President Biden, as some of his first actions in office, reversed the prohibition on diversity and inclusion training and asked agencies to assess equity across the federal government. I'm also encouraged by Secretary McDonough's early and strong commitment to improving workforce issues, including the formation of his Inclusion, Diversity, Equity, and Access Task Force to map out a course for a strategic action at VA. Now, VA must recognize the extraordinary diversity of our veteran population, which includes more women, LGBTQ+, Black, Asian, Hispanic, and Native American veterans than ever before. And we need to ensure that all veterans know that they have a place at VA and feel safe and welcomed walking through its doors. VA must also leverage and foster the diversity of its workforce and address systemic discrimination in the workplace. As Chairman Pappas and I explained in our March letter to the Secretary, there are steps that VA can take today to break down barriers, develop strong solutions, and provide localized resources to support the Secretary's vision. For example, Chairman Pappas and I recommended doubling the number of VA's technical assistance reviews for local facilities seeing discrimination or equity concerns. The reviews have helped struggling facilities identify areas for improvement and respond more effectively to employee concerns. I hope to learn more about these reviews and other promising practices. But clearly, the breadth and depth of issues reported at facilities around the country, VA's current plans of providing technical assistance support to only 6 facilities each year is not enough. Let me be clear. No matter what administration is in charge of the executive branch, no matter who is the secretary, Congress expects the department to prioritize workforce diversity, equity, and inclusion for all workers. I recognize that we are still in the first few months of the secretary's tenure at the department, and I know both from private conversations and his public statements that his values align with ensuring a diverse and inclusive VA workforce. I look forward to continuing the conversation so we can together take major strides towards these goals. And while VA has its share of challenges to address on this front, strategies and solutions also abound. And I look forward to hearing from our witnesses today on why this topic deserves more of our attention and how VA can transform its workforce. Thank you, Mr. Chairman. I yield back.
Well, thank you very much, Chair Takano, for your remarks. And we will now turn to our witnesses. I will start by recognizing our witnesses from VA, Mr. Harvey Johnson, Deputy Assistant Secretary for Resolution Management, Diversity, and Inclusion. And he's joined by Dr. Anne-Marie Duncan, Associate Deputy Assistant Secretary for Resolution Management, and Ms. Ryan Pugh, Director of Workforce Analysis at the Office of Resolution Management, Diversity, and Inclusion. Mr. Johnson will provide the testimony for VA, and Mr. Johnson, you're recognized for 5 minutes.
Good morning, Chairman Pappas, Ranking Member Mann, and members of the subcommittee. With me today are Dr. Anne-Marie Duncan, Associate Deputy Assistant Secretary, and Ms. Ryan Pugh, Director, Workforce Analysis. Thank you for inviting us to present our views on conscious inclusion, diversity, equity, and access, which I will refer to as conscious IDEA. VA's strategic goal is to build on the principles of conscious IDEA so that it is ingrained in everything we do. We can achieve our mission only by embracing the incredible diversity that defines our veteran population and all of America and leveraging our employees' talents and passions. VA is committed to advancing conscious IDEA in the workplace and finding the right tools to enable all VA employees to reach their full potential. Secretary McDonough has been clear since his first day that he will not accept discrimination, harassment, or assault at any level or at any VA facility. VA is committed to ensuring all staff, patients, their families, caregivers, survivors, visitors, and advocates are physically and psychologically safe, comfortable, and free of harassment and discrimination. The department uses an enterprise-wide approach to address and engage instances of discrimination and other unwanted disruptive behavior. My office has met with facility leaders referenced in your March 10th letter to Secretary McDonough, and we've seen measurable improvement. Specifically, the Kansas City VA Medical Center appointed 12 special emphasis program managers and is in the process of hiring a diversity and inclusion officer. The special emphasis program managers review policies, practices, and procedures to help eliminate any discrimination against minorities, women, and people with disabilities and report those findings to the medical center director. We are taking a similar enterprise approach with VA medical centers in Dublin, Milwaukee, Bedford, and many more facilities to include the VA central office. This year, VA will perform equity assessments on underserved communities. The term underserved communities refers to populations sharing a particular characteristic as well as geographical communities that have been denied fair and just treatment. Secretary McDonough directed the VA Chief of Staff to charter a 120-day task force, which commenced last month. The task force is comprised of VA subject matter experts and thought leaders from across the department charged with setting VA strategy to execute Conscious IDEA. The task force is comprised of 4 subordinate working groups focused on internal audiences, external stakeholders, measures and metrics, and strategic communications. The task force will leverage VA's vast diversity and use it as a major source of strength. As such, VA, through the Veterans Experience Office, is using human-centered design to identify and research the moments that matter throughout employees' entire work experience at VA, from recruitment to retirement or resignation. The journey maps are another tool we use to identify bright spots and pain points and provide insight to barriers and drive action around developing tangible solutions. This past year, VA began conducting virtual technical assistance reviews to help facilities in obtaining a model EEO program. In January, VA initiated a barrier analysis work group to investigate triggers that indicate workplace policies, procedures, or practices which have a negative impact on protected EEO groups. In closing, equal opportunity is the bedrock of our nation's democracy. Our diversity is one of our greatest strengths. Our nation's veterans and VA employees deserve an ambitious, whole of VA conscious agenda that matches the scale of the challenges we face. I believe VA is on course to meet that challenge. My colleagues and I are happy to answer any questions you or other members of the committee may have. Thank you for listening to me.
Well, thank you, Mr. Johnson. Our next witness is Dr. Sheila Elliott, a pharmacist at VA and the president of AFGE Local 2328 at the Hampton VA Medical Center. Dr. Elliott, you have 5 minutes.
Chairman Pappas, Ranking Member Mann, and members of the subcommittee. Good morning. My name is Dr. Sheila Elliott, and for more than 30 years, I've been serving veterans at the Hampton VA Medical Center in Hampton, Virginia. It has been my honor and pleasure to serve our nation's veterans in my own home community. Over time, I have seen how things at the department have changed, and sadly, how they have remained the same. I appreciate the subcommittee providing me with the opportunity to participate in today's hearing. As a leader in my union, I've had the unique opportunity to represent my coworkers in the workforce and to see firsthand how VA policies get implemented at the facility level. Sometimes we're able to work together to make change and see progress, but far too often we hear wonderful talk from VA headquarters, but fail to see grand ideas become reality on the ground. That's the perspective I want to share with you today. Voices from the frontline workforce at the VA. Let me begin by saying the obvious. It is imperative that the VA take issues of diversity, inclusion, and equality seriously. One immediate step the department can take is to ensure that every facility has a full-time EEO manager and EEO counselor on site, and that the positions get filled when a vacancy occurs. For example, at my facility, when an EEO manager left, we had to wait just about 1 full year before that vacancy was filled. 1 year is too long for any position to remain vacant, let alone one that exists to make sure people are treated fairly. The VA must not let that happen again. Another area where I would like to see the VA improve is in providing remedies for employees. Right now, oftentimes the only avenue available for an employee seeking assistance is to file a reasonable accommodation request with Human Resources. Reasonable accommodation request should not be the only avenue for an employee to get assistance or for an employee to continue working at the department. One thing the VA can do immediately is to empower their managers at every level to provide simple accommodations for employees who may need assistance. This means allowing the lowest level frontline supervisor to have the authority and authorization to provide relief without having to go through Human Resources. Empowering frontline supervisors in this way will allow the process to be streamlined and for employees to get the assistance they need rapidly. Another troubling employment practice that my colleagues and I have seen is the willful violation of the American with Disabilities Act. AFGE has received reports from employees who have been pushed out of the job they were in, that they were hired to perform, and into lower paying positions. We have also seen managers push employees toward filing for early disability retirement. These practices must end, and they must end now. The VA must support its workforce, not to try to create ways to eliminate positions. Another important issue is hiring practice. It has been my experience that non-white applicants have a much more difficult time getting hired and promoted by the VA than their white counterparts. Last summer, AFGE filed a FOIA request concerning the VA's hiring and promotion practices. The information showed that in 2019, 40,578 Black individuals applied for management positions. Only 2.5% were selected. Again, in 2020, our survey found that of the 17,257 Black individuals who applied for management positions, again, only 2.5% were selected. The VA must work harder to ensure that its management and senior officials look more like the veteran population and its workforce. Ultimately, if the VA is truly serious about providing fairer and more equal and equitable workplace, it has to get serious about holding management officials and human resources accountable. This means, at a minimum, making sure crucial positions are filled and that non-white applicants are given a fair chance to rise and excel. I look forward to working with this administration to make permanent changes at the VA, and I think the members of this subcommittee share that goal too. Thank you again for the opportunity to be here today, and I look forward to answering your questions.
Well, thank you very much, Dr. Elliott. Our next witness is Mr. Victor Lagrune, the Director and Chairman of the Black Veterans Empowerment Council. Mr. Lagrune, you have 5 minutes.
Thank you, Mr. Chairman, honorable members, and guests. I'm here today on behalf of the Black Veterans Empowerment Council and the thousands of veterans that we represent around the country and around the world. Today, I'd like to speak to several issues that are of very grave concern to us as an organization as they pertain to the treatment, the promotion, and the retention of veterans and employees of color, in particular African Americans, in the VA system. I'm before this committee today to discuss the data and analysis that the Veterans Administration should be collecting, but perhaps is not, to improve their employment operations, in particular areas, hiring, firing, promotions, attrition, and EEO complaints, especially as it relates to minority groups, underserved, and at-risk employees. After speaking with several former and current employees within the VA system, it is evident that there is much work to be done with the new administration to ensure that there is transparency in how we treat, support, promote employees of color and those who represent underserved communities. Over the last few years, we have seen several reports of widespread discrimination and incidents of racism leveled against Black employees in the VA system. Many of these employees faced the ongoing retaliation from superiors and leaders in spite of whistleblower protections that are in place to mitigate these very issues. While we are currently awaiting the findings of several FOIA requests submitted by the Black Veterans Project, we are certain that the findings within these reports will be consistent with the various reports and articles that we've listed within our written statement. As a diversity, equity, and inclusion practitioner, I'm well aware of the industry standards as they relate to healthcare and how we support a climate that is both a culture of inclusion as well as something that will promote long-term diversity. Given the current incidents and overwhelming evidence of racism, sexism, bias, and biased treatment to staff, faculty, as well as to some patients, the BVEC urges the committee to require a thorough reporting on the following items. 1, hiring. Given the current employment demographics, who is responsible for ensuring that the VA has equity in mind to guarantee representation? As it pertains to firing, Given the numerous challenges facing DEI goals, how do we ensure that all employees are given fair consideration for development through appropriate corrective action? Promotions. What does the data reveal as to who gets promoted and who gets passed over for promotions within a system that has shown great inconsistency as it relates to pursuing diversity within the VA system? Attrition. Attrition continues to be a highlight as the revolving door for people of color as they work and pursue promotions within the VA system. There is a great need to look at and track these numbers, because I think that the numbers will be quite revealing as to where the culprit are within the system. EEO complaints. EEO complaints must have a better oversight to ensure the integrity of the process remains fair and confidential for those seeking support through administrative channels. I fully appreciate that these requests may seem too large for any one office or body to ensure that they take place. However, that is our charge. This is why the members of the BBAC and the thousands of veterans and service members we represent around the world and globally ask this body to push for the necessary oversight and transparency. Our hopes are that every veteran, be they client or employee, have the appropriate treatment and respect we all hope that they receive. I yield my time back to the chairman.
Well, thank you very much, Mr. LeGrune. Our final witness is Mr. Rick Wade, Senior Vice President of Strategic Alliances and Outreach for the U.S. Chamber of Commerce. Mr. Wade, you have 5 minutes.
Chairman Pappas, Ranking Member Mann, Chairman Chicano, and other members, thank you for the opportunity to provide perspectives from the business and industry of the United States of America. I believe we agree that all Americans should have a fair chance to earn their success, to rise on their merit and live out their own American dream. But often the opportunity to obtain an education, secure a job, or even a promotion, or grow a business is still determined by your color or even your gender. Ensuring diversity, equity, and inclusion is first about acknowledging that race, gender, and other opportunity gaps do exist. It's recognizing that bias, whether conscious or unconscious, in companies or in agencies, prevent organizations from effectively serving their consumers and citizens and maximizing their full potential. At the U.S. Chamber, we believe that the moral case for greater diversity, equity, and inclusion in the workplace is indisputable, and just as sound is the business case. Evidence shows that greater diversity can translate to more innovation, bring different ideas and viewpoints to the table, and provide a deeper understanding of the customers and communities that organizations serve. Our partner, the W.K. Kellogg Foundation, asserts that the American economy stands to gain $8 trillion by 2050 by closing the racial equity gap. Moreover, businesses that embrace diversity and inclusion perform better across multiple financial metrics. According to McKinsey, a strong correlation exists between diversity in leadership and quarterly earnings. Companies in the top quartile for ethnic and racial diversity on executive teams are 33% more likely to have industry-leading profitability. Greater diversity leads to a healthier workplace culture. Leadership starts at the top, and the Chamber is fostering diversity, equity, and inclusion, both within our own ranks and throughout the business community. Like any business imperative, diversity, equity, and inclusion requires clear strategy, deliberate focus, and sustained action. We are providing businesses with the tools they need to advance greater racial, ethnic, and gender representation across their workforces. We supported H.R. 1277, the Improving Corporate Governance through Diversity Act of 2019, and are now working with the National Association of Corporate Directors to connect at least 250 Black executives to corporate boards by the end of 2022. Our Next Gen business partnership with historically Black colleges and universities introduces students to career opportunities in business and industry. Incidentally, HBCU hospitals and medical schools are rich sources for research and innovation, pipelines for diverse physicians and nurses and other healthcare professionals. Ensuring that minority-owned businesses get a shot in government contracting and corporate supply chains should also be a part of diversity programs. Other best practices include organizing staff forums for honest conversations, ensuring pay equity, employee training, naming a chief diversity officer, employee affinity groups, diversity advisory councils, and mentoring programs to support diverse managers. Data is important. I also would like to say that my colleagues at our foundation have long worked to work on issues of related to women in the workforce and as business owners, as partners with the Gill Foundation, incorporating inclusion, promoting the importance of LGBT inclusion across America, across corporate America. In closing, let me say that this American flag that sits behind me was a flag that draped the coffin of my father, who served in the United States Army and fought in the Korean War. Dad never finished high school, and the highest rung that he ever reached on the corporate ladder was a forklift operator at the local textile mill in my hometown of Lancaster, South Carolina. But he was a proud veteran and always bragged that the Walter Reed Hospital was the best hospital in the world. My 4 brothers followed his footsteps, served in the Army, raised families, and built great futures. Several years ago, one of my brothers, Master Sergeant John Wade, a 20-year veteran with tours in Panama, Korea, and Germany, was diagnosed with cancer and eventually ended up in hospice at Springs Hospital in my hometown. During his final days, he asked me to move him to the VA hospital in Columbia about an hour away. I honor his wish. His only wish was to go to the VA hospital. And at his bedside, as he took his last breath, we stood there, me and my family. His hope was the Veterans Administration Hospital, and the hospital did all they could do. So it's my hope that we will do all we can do our duty to provide the very best care for our veterans, no matter who they are, where they came from, what rank they reached, or what place in life that they ended. Thank you, Mr. Chair.
Well, Mr. Wade, thanks very much for your testimony and for your family's service. We appreciate the insightful comments of the entire panel, and I'm glad that you all could join us here today. We'll now turn to the questioning portion of today's hearing, and I'll begin by recognizing myself for 5 minutes. And I think you all see why it's important for us to have one panel here so that we can really have a conversation between the different parties that are represented, especially VA. And I think there's a lot to unpack from what we heard in the testimony here today. Picking up on what Mr. Wade just said, where he effectively made the business case for diversity and inclusion. I think, according to his words, businesses that embrace diversity and inclusion perform better, and we certainly want that to be the case for VA as well. So I'm wondering, Mr. Johnson, if I could turn to you first, just thinking about diversity and inclusion initiatives and how there's a moral case for it, it's the right thing to do, but that there's also a business case as well. I'm wondering if you agree with the comments from Mr. Wade.
Thank you for that question, Chairman Pappas, and absolutely I agree with those comments. As I listened to everybody today speak on the importance, and I will refer to it as conscious idea, which I believe covers most of it. I look at the other panel members, Mr. Wade, Victor LeGrune, Dr. Elliott, absolutely I agree. And I too believe there is a return on investment for good conscious idea in everything we do.
Well, great. And maybe I could ask our other witnesses if they agree with that as well. Dr. Elliott, do you agree with the assessment that these initiatives are the right thing to do, but also will result in improved performance for our veterans?
Thank you for that question. Yes, sir. I do believe that these things are the right thing to do. But they really need to be taken seriously at the facilities, from the VA central office to the VISN, right down to the local facilities. We had some training on reasonable accommodations within the past year, but I have not seen any difference in the way the employees are being processed through that program. And so that tells me that we're checking off boxes, but we're not really addressing the root cause, and our managers and our human resources people are not buying into it, and that needs to change.
The implementation is so important, and we appreciate your perspective. Mr. LeGrune, I'm wondering if you could comment on whether the business case is an important one to make. That means, achieving a more diverse workforce will mean a better run VA with higher quality of service.
So as we look through the lens of what our private public partners are doing, the business case is what makes the most sense. because people understand dollars and cents. The piece that is the most compassionate case to make is that every single day we're in the business of people. We're in the business of serving and preserving lives. Those lives in which we asked our nation to serve, and now that they've come home, we owe them better. It is difficult to say that we value that level of treatment if we don't treat the people who are responsible for delivering that care appropriately. So what we do see is a system that is rather pervasive, and if not pervasive, I think we could use the description as tolerant for racial bias. And because of that, we see ongoing systemic institution after institution having these issues. So I agree wholeheartedly that we have, as Mr. Johnson put it, the calling to do the work. I think it's extremely valuable. My concern is that without the appropriate oversight, none of this will transpire.
Well, Mr. Johnson, maybe I could turn it back to you to respond to that, and also answer the question of resources, whether the department has the resources to be able to implement some of the initiatives you talked about. Could you talk a little bit about how VA is going to look to get it right, and whether the systems are in place in terms of oversight, and whether this process is resourced?
Thank you, Chairman Pappas. Yes, I'll start with the Secretary has directed a task force be formed, and we're calling it IDEAR. Again, conscious IDEAR. Within that task force, there are 4 subgroups. Internal, looking at everything internal to VA. External, just that, looking at our external partners, stakeholders. Measures and metrics, because I heard several people say, how do you define success? Measures and metrics is one of those. And finally, how do we communicate that call to action to everybody? This is not just about leaders, it's a call to action to everybody in VA, because so often I have employees and just other stakeholders, so not just leaders, but everyone, especially now, because we're at this great moment of inflection asking, how do I get involved? And as far as resources, I have asked for additional resources. I have gotten them this year, and I've asked for more resources next year. And I'm happy to elaborate on what I have and what I need, but I see the timer expired.
Well, the time is up, and I'm glad that you acknowledge that more resources should be provided for this worthy goal, and I hope we can get into that in a second round of questioning. With that, I will turn things over to the next person in our lineup, and that's Ranking Member Mann. You're recognized for 5 minutes.
Well, thank you, Mr. Chairman, and thanks again for having this hearing and for pulling this great group together. And it's wonderful for Chairman Takano to join as well. My question initially is for Mr. Wade. And first off, Mr. Wade, thank you for that story at the end of your opening remarks there about your dad and the flag that's behind you. That's inspiring, and it's really kind of why all of us are here in many ways. But my question for you is, 2 months ago, you testified before the House Committee on Financial Services and made the point that policymakers should be careful to structure diversity policies in a flexible and durable way, because that might make what may make sense in a large metropolitan area may not make sense in a rural one. I agree with that. I proudly represent a large, mostly rural district, and agree completely that what might work in Washington, D.C. does not always work in the 1st District of Kansas. Would you provide some more details on how Congress and VA can structure more flexible and durable policies?
Yeah, thank you, Congressman Mann. You're absolutely right. It is important to understand that one size doesn't fit all. And it's very important to adapt to the cultures and the communities and develop the pipelines of talent from the communities from which the VA hospital lives. That is the practice that we see across the private sector. It's extremely effective. Flexible plans, we're not going to get there overnight, but also, as was mentioned earlier, measurable plans that are rooted in data. So, and one of the other things I will add, Congressman, as you think about flexibility, is engaging that local community. You know, I meet regularly with representatives from the API community, the Hispanic community, LGBT community. That insight and perspective, those relationships are very important in understanding the cultural context of how we serve our customers, how perhaps the VA should be focused on serving veterans.
Yeah, great. I agree. Thank you. My second question would be for Mr. Johnson. Across nearly every race and gender, the VA exceeds the relevant civilian labor force, the RCLF metrics for minority races. That seems to be a good thing. However, minority races are underrepresented in leadership positions. We already discussed that a little bit. VA does appear to be trending in the right direction in the past few years, with minority races holding slightly increasing percentages in leadership positions. Do you believe the VA is on the right track to addressing the issue, and how can Congress assist you?
Thank you for that question, Ranking Member Mammon. And I think there's a number of things I would say to that. I think it starts with good grooming. So when you look at how none of us got to the positions we're at without being groomed or mentored, so I think we have to look at how are we selecting people for the Senior Executive Candidate Development Program? How are we selecting them for Leadership VA, Aspiring Leader Program, and other leadership programs? I think we have to look at how we're mentoring and grooming people at the GS, lower grades, I would say, up to 13, because that's where we start to see the disparity. When you get to GS 13 and above, that's where we tend to have less than favorable representation. And I think it starts there. So when I mention those work groups, those subordinate work groups, I'm on the internal group. That is one of the things that we will be looking at.
Okay, thank you. Similar question maybe for Dr. Elliott and Mr. LeGrune. Though there's a long way to go, do you believe the VA is on the right track, and what specific steps would be taken to improve the leadership pipeline for our underrepresented population? Maybe we'll start with you, Dr. Elliott.
Yes, thank you for including me. The track is there. We've got to get some speed going down that track.
Okay.
And that's where I see the issue. When we see someone coming in at a higher level who happens to be a person of color, quite frankly, at my facility, we're surprised many times. And that's the case at some of the other facilities as well, because we don't expect that. But there's a lot more that needs to be done.
Okay. And Mr. LeGrune, I know we only have about half a minute here, but do you think we're on the right track, and any specific steps you think we ought to be taking to improve our leadership pipeline?
To be honest with you, it's rather difficult to fully invest in processes that we've seen that have existed for some time and expect them to yield different results. Right. So I think we're absolutely right when we say that we need to put our foot on the gas, to expect more, to push further. I also believe that there have to be very stringent guidelines in place in which we can review what the data says in real time. Because if we don't have all the information in front of us, it's very difficult to make a full assessment of what we're doing and how well we're doing it across the VA system.
Yeah, great. Thank you all, and thanks for being here. Mr. Chairman, I yield back.
Thanks. With that, I'll turn things over to Chairman Takano for 5 minutes of questions.
Thank you, Chairman Pappas. Let me just start off by saying I'm impressed by all the testimony. There's a clear consensus that there are serious ongoing problems of workforce discrimination and inequity that need attention, but these problems are not insurmountable. We have so many medical centers and facilities. VA does not need to look far to identify and share the best practices. Now, Mr. Johnson, your testimony describes some actions taken at the Kansas City facility. Could you explain more about what was done and whether, if successful, this could be replicated at other VA facilities?
Chairman Takano, thank you for that question. And the answer is yes, I do believe it can be replicated. I went to the Kansas City facility. I met with the facility director, David Isaacs. I did focus groups with employees. I met with the union. I met with external partners in the community that wanted to help. And I believe they have done a number of things, starting with, I think it was a big step to hire those special emphasis program managers. Because now they are recognizing all of the important events that happen throughout the year. Obviously, we're doing Asian American Pacific Islander, Pride Month coming up, just did Black History. I think that's an important step. They are also hiring a diversity and inclusion officer, and I believe they're very close to bringing that person on board. And finally, if you look at the all-employee survey scores, which we have, they have gone up in so many categories to include best places to work. Thank you.
Well, great. Ms. Johnson, it seems that the Kansas City example also showed the need for medical center directors to support and engage robust employee and community stakeholder groups. Are facility leaders across the country adequately engaging these groups?
I think so. I think there's probably room for improvement, but I think we do engage them. So like whether it's Blacks in Government, today I believe I'm pretty sure it went out this morning, but a Federal Register notice to implore VSOs, state and local, to help us with the Secretary's task force on sexual assault and harassment. So yesterday I spoke to the Minority or Center for Women Veterans partners at a breakfast. They want to help us with our federal women's program. We are sharing those practices enterprise-wide with Veterans Health Administration, benefits, and National Cemetery.
Well, Mr. Johnson, are there ways that you measure the engagement? Is there a way objectively to measure? Is there a system-wide measurement?
I'm not aware of a system-wide measurement that would say we wanted to do these many external engagements, we accomplished this many. But as we form this work group, and the work group's already commenced, it commenced April 1st. The internal work groups just kicked off, and one of those is measures and metrics. So we are going to look at ways to show that the VA is changing and progressing in these areas.
Well, thank you. Mr. Wade, I was very impressed with your testimony, and you mentioned maybe engaging HBCUs and minority serving institutions. I know the administration has talked in its education agenda. I've talked to some folks in administration that are looking to expand graduate medical school education. Would a focus on HBCUs and MSIs and producing more medical professionals help in diversifying the upper ranks of the VA?
Mr. Chairman, absolutely. I think HBCUs and MSIs not only are a great resources for talent, but the research, the innovation, delivery of healthcare. I mentioned the medical schools and hospitals. We can learn from them. They understand these populations, and I think there's tremendous value in addition to talent, but helping the VA hospital and other private sector hospitals understand at the end of the day, how can we deliver better access to care, in this case for veterans as well as their families.
I'd be interested in exploring, you emphasize the research function. I want to make a statement before my questioning time is up. Let me just say that I want to go back to Mr. Johnson. Let me acknowledge that the direction and plans of the Secretary and the Department to address workforce diversity, inclusion, and equity is going in the right direction, in my opinion. And I am impressed with your testimony and that of your colleagues, but for many years, there clearly should have been a much higher level of priority placed on this issue. And not only does the lack of staff and support translate into workplace problems not being fully addressed, but without the commitment of resources, many other important and innovative ideas, including those described by our other witnesses today, will not be implemented or followed through on. So I look forward to a continued discussion on how VA and Congress can work together to ensure adequate resources for these critical diversity and inclusion improvements. Now I yield back, Mr. Chairman.
Thank you, Chairman Takano. And I will now turn things over to Ms. Radewagen for 5 minutes.
Quick? Yeah. Talofa, good morning. Thank you, Chairman Pappas, Ranking Member Mann, and everybody else, the panel, for being with us this morning. Special talofa to Chairman Takano. Mr. Johnson, I was concerned to see that over the last 4 fiscal years, the number of formal EEO complaints remained stagnant at about 2,800, while the resolution rate hovered at only 51%. Would you please explain what needs to happen at VA to bring down the number of complaints and increase the resolution rate?
Thank you for that question, Representative Radewagen. And let me just say this, that you're correct. We're going to average about 5,700 informal complaints, 2,500 formal. I have 38 counselors today. I have asked, I would like that cap that restricts us to be removed so that we could hire to the 50 that I am budgeted for. And then I've asked for an additional 36. those counselors would be used to proactively do traditional counseling with the aggrieved party, labor unions, management, etc. That's what we would like to do. And for a resolution rate, when it comes to EEO protected categories, you're right, it's about 53% this year. For non-EEO, it's 86%.
And Mr. Johnson, are you able to access American Rescue Plan funds to increase the number of site visits and barrier analyses conducted each year?
What we have done, and one of my colleagues, Ms. Ryan Pugh and Dr. Anne-Marie Duncan, we have discussed this. We are ready to increase the number of technical assistance reviews we do. I have one person who does them now. I have asked for an additional 12 people under the diversity and inclusion shop. Those people would be trained so that we could do not only barrier analysis, but technical assistance reviews concurrently instead of one at a time.
And as a follow-up, will the FY 2022 budget also provide your office additional funds to complete this type of work?
I want to thank the members of Congress and the department's leadership, because I believe this year we saw an increase in both our employees and budget, and next year I'm anticipating the same. If we get that, we will have the staff we need to make significant improvements.
Okay, and question for Mr. Wade. Can you please tell us about the business case for diversity and provide more details about the W.K. Kellogg Foundation's findings that diversity increases earnings?
Yes, Congresswoman Gorman. The Kellogg report, the business case for racial equity, did research in a number of policy domains, from unemployment, education, housing, criminal justice, a number of areas, and an extensive body of research that just basically said if we close these gaps, whether they're in education, in childcare, in all of these areas, that our GDP grows by $8 trillion. We can debate the number, but the whole point there is that there is a public sector opportunity for us to address inequalities, particularly structural inequalities that exist across our society. And as I mentioned earlier, McKinsey, Deloitte, and others have done tremendous research in the private sector about the case for diversity, equity, inclusion in the private sector. The data is very clear that the more inclusive organizations are, the more profitable. I do believe that that same logic can extend into our government agencies at the federal, state, and local level in terms of our ability to provide accessible services to the citizens at the local, state, and federal level.
Thank you, Mr. Chairman. Yield back.
Thank you. I now recognize Representative Luria for 5 minutes.
Well, thank you, Chairman Pappas. And I understand that Representative Sablan has another commitment for a hearing he needs to chair. I'd be happy to let him go ahead of me for his question.
Oh, sure. Are there any objections to allowing Representative Sablan to go up next? With that, I'll turn it over to you, Mr. Sablan, for 5 minutes.
Thank you, Mr. Chairman. Now, thank you, Dr. Luria. You're so sweet. I appreciate it. I do need to. I have a hearing on hidden labor. I'm not going to criticize the VA. I mean, it is true that it's a new leadership just month into the term, but I agree with Dr. Elliott that I have seen that, heard that over and over and over again, and yet the problem persists. I'll give one example. In my district, where we have an admin staff, I'm also a nurse assigned to the contracted doctor. It took a year to fill another position, and when that position was finally filled, the person who was hired had to resign because he was sick, only to find out that that person was hired from another office within the VA. And so I have my own suspicion that they knew someone was sick and they wanted to get rid of that person and send them out to the farthest place you can be from the mainland. But that's, we look forward to progress, so we'll go ahead and pass that. But you see, Dr. Elliott, again, thank you for your participation in today's hearing. And you spoke about the implementation of VA policies at the facilities level and how there are times when you and your colleagues can work together to make change and see progress. But far too often we hear wonderful talk from VA headquarters that fail to see grand ideas become reality on the ground. I've seen that talk myself. So what do you see as the reasons for the disconnect between headquarters and the facilities in implementing VA policies? And also, what were the factors or conditions that led to those instances when you and your colleagues were successful at implementing the change that was necessary?
Thank you very much for that those questions. As far as the disconnect, and I'm hoping that I'm answering everything that you're asking. As far as the disconnect, a lot of times there really isn't a disconnect from central office to the VISN to the local level. Let's go back and think about it. We've had years and years of anti-employee, anti-union animus. Those people still work in the department. Within the last 4 years, more people were brought in. And those people have those same sorts of ideas. And despite the fact that our president and our secretary, their heart is really in making change, there is resistance there that we see from central office to the VISN down to the facilities. There have been times when we have made positive gains. Sometimes it's been something that management really wants to do to help the employee, but that's not often the case. Many times, sometimes it just takes a long time to get things processed through. But oftentimes, if there's something that management really wants to get done, and they'll come to us and they'll work with us because they need to check off that box. I want to see a real vigorous, real relationship, a real partnership between the staff, between the unions, between HR, between management, and so forth. I will say that now with the WMC that we have, and everything is just decentralized all over the nation, to me, that has not helped us.
Okay.
We don't know who is involved.
Okay, so let me ask Mr. Johnson. Let me ask. You just heard Dr. Elliott said what the relationship that needs to be established. Can we get that done?
Absolutely. I believe we all want the same thing. And as I heard Dr. Elliott speak, I agree. There has to be this unity of one, because we're one VA focused on serving our veterans. And I do want to pull in all stakeholders to do this. So yes, I do believe this needs to happen and it will get done.
Okay, that's what I wanted to hear, is it will get done. I think it's necessary. And this is not the VA alone. This is throughout the whole federal government. There needs to get these things. Mr. Chairman, I thank you for this. I need to run, but Dr. Luria, thank you also very much for the favor. I appreciate it. Thank you, sir.
Thank you, Mr. Sablan. And with that, I'll turn things over to Ms. Luria for 5 minutes.
Well, thank you, Chairman Pappas and Ranking Member Mann and Chairman Takano for joining our subcommittee hearing. I think that shows the importance of this issue to the committee. And I wanted to start by recognizing Dr. Sheila Elliott, who lives here in Virginia's 2nd District and is a leader of the AFGE workforce with Local 2328 at the Hampton VA. So thank you, Dr. Elliott, for being part of the hearing today. And I wanted to continue to touch on what Mr. Sablan had mentioned. Despite the fact that the Biden administration revoked the previous administration's order to reestablish its diversity and inclusion training and many other efforts to end racial discrimination with the VA, such as creating a strategic plan, creating the Black Veterans Empowerment Council. I think I've heard from what you've said already, Dr. Elliott, that you haven't seen these things trickle down to the Hampton VA. I mean, can you touch on have there been any changes, since this administration and lifting of these orders that have helped at least start moving the needle with regards to diversity, inclusion within the workforce?
Well, there have been, as I said previously, there have been classes. Oh, yes, thank you for the question.
Yeah.
There have been classes and so forth, but I just have not seen real changes in terms of what comes to my office on a daily basis with respect to how the staff are being taken care of or lack thereof at my facility. When I did reach out to some of the other stations in VA locals in our visit, they were having some of the same problems that I was having, especially along the lines of promotion and those kinds of things. At my facility, it's a matter of trying to move out of the area where you're in and you want to expand your horizons. We're having difficulty with that. We're having difficulty with that reasonable accommodation, the ADA piece. That's a really big piece that I've had problems with.
Well, thank you, Dr. Elliott. I understand that there's been some training done, but the sort of implementation and carrying that to the next level of changing some of the situations for employees has, in your words, not yet materialized. Do you know, or can you attribute the holdup? Is it a particular obstinance at the level of leadership? Is it perhaps maybe not clear enough guidance from VA headquarters? What do you think would help move this along?
Accountability would help move it along. I don't think that there's a lack of guidance. I think that there's so many moving pieces and that perhaps leadership may not be aware of everything that's going on so that they can say, well, we're going to stop this right now, fix this today. I think those sorts of things need to be said at my facility. We did many moons ago. We had a time when that did happen. That only lasted about maybe 9 to 12 months, and then that person moved on. But now I think that there needs to be more information sent to the top leadership, and they need to say, stop it right now. This needs to be changed.
Well, thank you for that feedback, Dr. Elliott. And I wanted to also shift to the discussion that, and you said in your remarks that every facility needs to have a full-time EEO manager. And I know that my colleague, Representative Connor Lamb, who's also on the HVAC committee, as well as the ranking member Mann, have introduced legislation to lift that cap of 40 EEO managers. And I know that Mr. Johnson, spoke in support of that. Could you, describe, what the situation is? Is there an EEO manager at the Hampton VA facility solely delegated to that facility? And if not, what benefit would that bring to the workforce there if they were to have someone dedicated to that role?
Yes, we do have an EEO manager. I would say she came on toward the end of last year, end of 2020, and she's been doing some of those trainings. She's reached out to the union. I've had various staff, seek her assistance and so forth. And she and I have worked together on some of the things that we're trying to do to try to mediate and fix some of the problems that we're having.
Great. Well, thank you for the update on that. I'm glad to hear that that position has been filled, and we'll look forward to continuing our dialogue and working with you for the Hampton VA and for the employees and the veterans. And thank you for the work that you do every day on behalf of our veterans.
Thank you.
Mr. Chairman, I yield back.
Well, thank you very much. And with that, I'll turn things over to Representative Spanberger for 5 minutes.
Thank you very much. I'd like to begin by thanking you, Mr. Chairman, for holding this hearing and certainly for inviting me to participate. Though I am not a member of this committee, I'm grateful for the opportunity to join. In the Commonwealth of Virginia, the VA serves a diverse veteran population. In the portion of the Commonwealth I represent, veterans travel far distances from rural communities across Virginia and even beyond our state borders to receive care. And notably in Virginia, the VA serves nearly 160,000 Black veterans and nearly 40,000 Hispanic veterans. So with such a diverse veteran patient population, the diversity and strength of the workforce really matters to the care that our veterans received. And to that end, I'm joining today because I have been troubled by some of the conversations that I've had with constituents who work at VA facilities in the Commonwealth, who've brought to my attention some of the allegations that they've brought to their management related to discriminatory behavior, racist language, and overall the existence of what they have classified as a hostile work environment. And certainly, I think everyone would agree that these allegations do jeopardize the quality of care that our veterans deserve, and which I know is the mission of the VA. So to that end, Mr. Johnson, I'm very heartened by the agency's stated commitment to diversity, equity, and inclusion in the efforts for fiscal year 2021 in the strategic plan. And I would just note on behalf of my constituents that one of the things that I have heard frequently is that there are challenges trusting the EEO process. And so it's been for that reason that so many who I've spoken to have resorted to involving outside stakeholders, like the Veterans Integrated Service Network and their local AFGE union representatives, and in my case, their congressional representatives. So I wanted to make that statement very clearly on behalf of my constituents. And Mr. Johnson, I know this conversation topic has been raised by some of my colleagues, but I would like to just ask if there's anything additional that you would want to comment related to how there could be real long-term support and resources related to investigations and complaints to ensure that we're making sustained progress in rooting out potential discrimination.
No, absolutely. Thank you for that question, Representative Spanberg. And let me say that my office has counselors, but there are also EEO program managers in the field that do not report directly to me. We work closely with that group. They serve as liaisons to us. I would say that anybody who has a distrust or concern with the EEO process should contact the Office of Resolution Management, Diversity, and Inclusion. We assign investigators that are neutral. They do not report to management, they report to me. And those investigators do a report of investigation. We then turn those over based on their choice to their decision to the Equal Employment Opportunity Commission or the Office of Discrimination Complaints Adjudication. Those are independent bodies that will make a determination for a finding of discrimination.
Thank you very much. And Mr. LeGrun, I'd like to direct my next question to you. Unfortunately, we see clearly that there exist significant racial and ethnic disparities in access to healthcare across our larger healthcare system, but it appears to exist among our veterans as well, based on the data. So looking to improve the disparities arguably really require investing in our workforce to ensure that we can create and deliver culturally competent services. And so I'm curious, within this larger conversation about some of the challenges that we're seeing in VA institutions, can you discuss the importance of providing culturally competent care and addressing inherent bias in the system if we're to ensure the care that our veterans deserve, while also addressing some of the challenges within the workforce?
Thank you, Representative Spanberg. So that's a very important question, in part because all of the data shows from a healthcare standpoint, industry-wide, that representation matters because cultural competency does impact health outcomes. Mm-hmm. So when veterans don't seek care at the VA because of how they've been treated in the past, and I can give the example of my father, who's a Vietnam-era veteran, who said he went to the VA one time, and because of how he was treated at the VA that one time, he never went again. Mm-hmm. And there are thousands and countless of cases just like that, and incidents where we need our veterans to have faith in the system. I'm a consumer of the product. I was medically retired, so I understand what it's like to go to the VA, to have incidences where I've been treated in a way in which I shouldn't have to tell someone, I'm the Director of Veterans Affairs for the City of Chicago, this isn't appropriate. But that's what I've had to do. And because of that, that makes me concerned about the everyday veteran and their family who has to engage the system time and time again, and the system isn't always accommodating to the veteran. So we do need better accountability. We also need more transparency, but most importantly, I think that there has to be a balance between how we view a complaint and a concern, where we articulate it and place it, but also what the follow-through looks like within the system. Because I'm not certain that there's the appropriate level of oversight. I certainly recognize that Mr. Johnson does not have the resources he needs to provide the broad scope of oversight needed to say we're doing well here, we need to shore up things there, and how do we have continuity of care throughout the health system? Because currently, the reports that we've gotten over the last several weeks from different veterans around the country has been very, very concerning in that I don't feel that my voice is heard. I don't feel listened to when I don't have a doctor or a therapist of color. It's a hard wait to get a therapist of color for many of our veterans. These are very concerning issues. And I know that the VA has been working on these issues, but to be honest and frank, we haven't done enough historically. This goes beyond the last previous 2 administrations. This is a system-wide issue. And it's become a cultural issue where there are people within the system who have worked there long enough that they don't buy into change, right? And we do recognize that some people know that they can wait out an administration. So we do need to have the system in place that no matter who the secretary is, who the president is, this body can be ensured that our veterans are being treated in an equitable way.
Mr. Lugrun, thank you so much for your thoughtful answer. Mr. Chairman, thank you for your indulgence in letting us go over, but certainly Mr. Lugrun's experiences, I think, provided for a pretty extraordinary viewpoint. So I thank you for the additional time.
No, it's an important question, and we're glad to be able to accommodate you on the subcommittee. So thanks for joining us here today for this really insightful conversation. With that, we'll go to a second round of questioning if folks still want to stick around for a few more. I know I have some, and maybe I can start by turning things to Mr. Wade and just referencing something that you mentioned in your testimony, that the private sector is not just marketing diversity and inclusion programs, but really making embedded and committed engagements. That's the words that you used. I'm wondering what the key elements of a successful program are to make sure that these nationwide or enterprise-wide efforts make a difference on the ground at hundreds of locations. When you think of VA and how expansive it is, how can we set up a program to really make a comprehensive difference?
Mr. Chairman, I think a couple of elements. One, I think, is long-term investments and sustainability with a very, very strategic and, has been said before, measurable outcome. I think you got to be in this for the long haul. And we're not going to fix it all overnight. And I think that's the advice that I give companies and CEOs as I talk to them across the country. But you got to get in the game. The other part of that is celebrating successes as well. And that's extremely important. All of the components that we've already heard that I talked about earlier, diversity, equity, and inclusion all have to work together in order to get the desired outcomes. It's about having an inclusive environment where people, I think Mr. Lugrun talked about, where their voices are heard. So you can have the numbers, but if you don't have an inclusive environment and you don't have the equity, then it's not going to work. So it's got to be a long-term commitment with all 3 components working together in tandem for the long haul.
Well, thanks for that answer. And I want to address the issue of the technical assistance reviews next. It's one of the tools in VA's toolbox to address discrimination issues that arise at facilities across the country. And according to the strategic plan, VA will conduct at least 6 such reviews each year to help medical centers reach and maintain a model EEO program. Mr. Johnson, can you talk a little bit more about this and how VA chooses those 6 locations to receive a review, what's included in that review, and how those reviews will help improve how the workforce functions at a medical center?
Thank you, Mr. Chairman. Yes, so we have 5 that we have in the bullpen right now that we're getting ready to visit. Then we've got another 9 that we're about to schedule. As I mentioned before, I do want to increase the throughput of TARS. So we are looking to bring on additional staff, because I have 1 person right now who leads our TARS and brings in other experienced practitioners to go on those site visits. I've already spoken with her to say I want to, replicate what you're doing so that we can do multiple TAR visits concurrently. I go on those visits. Dr. Anne Marie Duncan goes on every visit. When we go there, we take a team of practitioners. We meet with focus groups, with employees, with supervisors, with the headquarters staff, with the unions. I am open to meeting with any local and external partners in the area. We conduct training on reasonable accommodation, civil treatment of others. We meet with their separate staffs individually. So yes, I actually very much, one of the things I actually really love about the job is doing a technical assistance review. I think we have worked well with the facilities that we have done them on. Thank you.
Well, thanks for that. And Dr. Elliott, maybe I could turn it to you next, since you have the on-the-ground perspective. I'm wondering if you could give us a sense of which activities at local facilities should Mr. Johnson's office really closely monitor to get a sense of a workforce's health and experience?
Thank you for the question. I'm wondering, what do you mean by activities?
Well, he talked about the type of engagement that he does when one of these reviews is underway. Just from your perspective, what sort of places should they be looking? What questions should they be asking? What are the important pieces for them to understand in undertaking one of these efforts?
Okay. Once again, I think he really needs to look at the reasonable accommodation numbers. I think that there needs to be discussion with staff who have applied for accommodation, those who may have accommodations ongoing, and how long it takes to get through the process, how many times a staff member may request an accommodation before even going through the EEO route. In my instance, I usually have them ask for it 3 times, and that's 30 days plus times 3 is 90 days that a staff member has already waited before they even request to go through the EEO process. So we really need to look at that. We need to talk about promotions and those sorts of things. I get concerns all the time about people who feel that they're being overlooked. The talent that they brought to our particular VA for many, many years is overlooked. And instead, someone who may have less experience or maybe even the same experience comes in from another facility, and oftentimes that person may be of a different race. So those are the concerns that we would like for him to look at.
Well, thank you. My time is up. Chairman Takano, do you have additional questions? I'll turn it to you for 5 minutes if you do.
I do. Thank you, Chairman Pappas. My questions go again to Mr. Johnson. It seems that a key ingredient to success on workforce diversity, equity, and inclusion issues is good data and thorough analysis. And I know that VA has equal employment opportunity data, such as complaint information, diversity data, and the all employee survey results. However, as in any data-dependent evaluation, the insights are limited by the types and quality. So how is VA improving the types and quality of data it gathers to support diversity, equity, and inclusion efforts?
Thank you, Chairman Takano. So one of the things we're doing is I'm excited to roll out a new system called E-Squared, Equal Employment Opportunity, E-Squared, hopefully in the next few weeks. And that's where we track all our complaints. That gives us greater reporting capability. We have hired data scientists at VA, so we know that the data tells the narrative. We are looking at the data and all sorts of fidelity behind it.
Well, can you tell me if there's any challenges that you've faced in gathering such data?
I think each day it's progressively better. And I say each day because today we're doing things like digital listening. We weren't doing that a few months ago. Digital listening is where we're using machine learning, natural language processing. We're monitoring social media sites, and we are listening to what people are saying when it comes to LGBTQ+, when it comes to race, Black Lives Matter, all those things. We are monitoring that. That was not something we were doing previously. We have hired a data scientist officer for VA. I've hired them on my staff. We are looking at the data in all sorts of ways to see what the data tells us. Thank you.
Well, thank you. Mr. LeGruen, if I could turn to you, What types of data does VA, in your opinion, need to gather to properly inform specific or tailored diversity, equity, and inclusion approaches?
So it's really important to remember when you're looking at data, the first thing you have to make sure you're doing is ensure that the quality of that data has integrity to it, right? The more we touch it, the more likely that there's some level of corruption within the data process, right? Whether it's the collection, the processing, or the dissemination of the data, right? So the other aspect of this, I want to know who we're hiring, where they're coming from, what that picture looks like. And then I want to know who are we retaining, who are we promoting, and then of course, who are we losing, and what does that look like? Because the taxpayer today is paying the cost for the attrition at the VA. The taxpayer today is paying the cost of the EEO violations, right? Again, that falls on the taxpayer, but it also impacts how we treat our veterans. So I want to see how that data, it can be more revealing and tell a more clear story, because it's one thing to look at it system-wide, but we need to also see a data profile from all of our major sites across the VA, because I can assure you what you're seeing in LA might be very different than what you see in a rural community, as opposed to what you might see in the city of Atlanta. And that's where we start getting into the devil. The devil is always in the details. So I think having a clear picture for the committee would also help them to better appreciate maybe this region is doing better than that region, and we need to replicate those things. But there's certainly a caution that I would apply to taking a system-wide snapshot and saying we're on par, or we're slightly above, or we did better than we did last year, because those are very nuanced statements that don't necessarily give us a very complete picture of what the data is revealing in VA sites specifically.
Well, does VA share workforce data with stakeholders such as the Black and Veterans Empowerment Council?
Unfortunately not. We currently, several of our members of our council have FOIA requests that are outstanding. And unfortunately, those members have to seek litigation to get the transparency necessary to look at how our veterans are being treated. I think there are better ways for us to partner with the VA. I certainly will look forward to partnering with Mr. Johnson in a way that might prevent some of those other litigations. But currently, we're going to use the tools necessary to get the information needed. And I think there's a better way to do it, certainly a more cost-efficient way to do it. So I think through having some collaborative effort with the VA and community-based organizations and VSOs might be a better tool.
Well, certainly, Mr. LeGrune, it would seem to me that having your organization be able to help scrutinize and question the quality of the data, and to point out how data might be deceptive or underestimate the nature of the problem, or how it might be painting a picture that isn't true, that would be very helpful for us to be able to move the ball forward. I thank you, and I yield back.
Thanks, Chairman. Representative Spanberger, I'll recognize you for 5 minutes.
Thank you very much, Mr. Chairman. So I would like to direct the following question to Dr. Elliott, but Mr. LeGrune, I welcome your comments as well, based on the last conversation that we had with my prior question. So AFGE represents thousands of VA workers and providers across the Commonwealth of Virginia, and has certainly been a powerful advocate for more transparent and a more inclusive work environment. And so I'm curious, Dr. Elliott, if you could provide any perspective about how VA and localized facility leadership can empower and engage unions, diversity councils, employee affinity groups on issues of diversity and inclusion to overall improve the work environment and ultimately the experience for our veterans.
Thank you for that question. I think we really need to talk to our staff. And I will say at my facility, we do have town halls every Friday at 11 o'clock, and the staff are invited. A lot of times, many of the staff can't get on because of their job duties, but we don't have a means of fixing that. Many times staff may not be able to get on because they may be face-to-face with a patient or something like that. They can go back and play it later. But I really would like to see more when we are able, face-to-face sort of interactions. As far as the affinity groups at the facility where I work, I can't speak to the other two VA facilities in Virginia. They're really not working at all. If we happen to get a group of people who put together something for Asian American History Month, I think that's coming up now. We might get something, we might not. And I found that those groups tend to be only active during that particular month rather than looking at a broad year-long approach. And I think that we need to do that because I really think that there's power in having the groups work together to help each other, to help mentor each other, help find good mentors within the facility and so forth. And I think that that would be better than just saying, oh, okay, this is on Black History Month. We're going to have a program on the very last day of Black History Month. We need to be doing something on an ongoing basis. That's where one way that I believe that we have not met the goal that we really intend.
Thank you. Mr. LeGrand, would you have any comments on what affinity groups, diversity councils, unions could bring to the table, or whether or not perhaps we may be leaning on them too much to do the work that should be happening directly within the VA? Any comments you may have on that? I open it up to you, sir.
Yes, ma'am. So thank you for that question, by the way. I think it's important to look at what the Fortune 500 companies are doing very well with their ERGs. Their employee resource groups or affinity groups are actually a resource and tool to further provide more, not just diversity and inclusion, but also cultural competency within the organization. As we continuously have sharing of ideas and thoughts, we become more culturally competent and better understanding of what others feel, believe, and think, and how they practice. The other important piece of this is that we want our employees to come to the VA every day and to be able to show up as their complete selves. The minute we start diminishing who people are and use conformity as a tool to rate, evaluate, and treat employees, that has a negative trickle-down effect. So what we're talking about is workforce culture, as well as the ability to demonstrate value in each and every employee that we have in the VA system. And I think that's the ultimate goal for all employees as they start helping us support our veteran patients and their families. So there's a better way, certainly, to utilize our affinity groups or ERGs within the VA system. We do have to empower them so that they have year-long activities that aren't specific to what we consider to be the food and fun activities, right? We'll do something on Black History Day, something on Hispanic Awareness Month. That doesn't give you the level of engagement and understanding and ultimately cultural competency that we seek within the VA healthcare system.
Mm-hmm. Thank you very much. And Mr. Chairman, I yield back.
Well, thank you. I do have one additional question I would just like to ask Mr. Johnson. I recently introduced a piece of legislation called the Improving VA Accountability to Prevent Sexual Harassment and Discrimination Act. It's a bipartisan bill. It grew out of our subcommittee hearing of last July and a recommendation from the Government Accountability Office. Mr. Johnson, your office would have responsibility for some of the steps this legislation would require that improve how VA reports, tracks, and addresses allegations of sexual harassment and discrimination. We haven't yet received an assessment from the department, and I'm wondering when you would expect we would be able to see this assessment as this legislation is beginning to move forward.
Thank you, Mr. Chairman. And when you say the assessment, maybe I want to make sure I understand your question. Are you looking at what we are doing with regards to the harassment and assault prevention and what steps we're taking?
No, I think we're looking for constructive feedback on the legislation to understand how this matches up with what is underway in the department. And, we marked up this bill earlier in the week, and we're just hoping to receive some technical assistance soon that would really be helpful.
May I call on Dr. Anne-Marie Duncan? Anne-Marie,
Yes.
would you like to speak on that, comment on that?
Thank you, Mr. Johnson. Chairman Pappas, we're looking at the bill right now because we have new leadership and a number of our positions have not yet been filled at the senior levels. We're looking at that, and the secretary is aware of this bill, but we do not have any views on it at this time. To touch on something that Mr. Johnson talked about, under the Veterans Healthcare and Benefits Improvement Act that also included the Deborah Sampson Act, we're looking at sexual assault and sexual harassment. We stood up a working group on that point. Originally, it was started by Mr. Johnson and us. We've expanded it to include all the requirements that are included in the Deborah Sampson Act, and we're working on coming up with a program of action on how to address these significant issues here at VA.
Okay, well, we are interested to get some additional reaction and information from the department. I think that would be helpful as we craft this particular piece of legislation. We're hopeful that it's going to be heading to the floor soon. So any information you can provide us would be constructive.
Thank you, Mr. Chairman. We will take that for the record and get back to you.
Okay. Well, thanks for that. That is all I had. Chairman Takano, do you have any additional questions?
I do, Chairman Pappas. Let me, I want to ask Mr. Johnson, we've heard it's often challenging to evaluate the career progression and workplace experiences of LGBTQ plus employees because of a lack of data. And since data for LGBTQ plus people is incomplete, how is VA identifying and addressing barriers that affect this segment of the workforce?
Thank you, Chairman Takano. So there's a new executive order, 13988. And it looks at sexual orientation, gender identification. Pursuant to that, the Secretary has directed a top-down review of all of our policies, programs, etc. My office is also looking at any discrimination complaints that have been filed that name LGBTQ+. And also, we are updating our transgender handbook. So we are doing a number of things across the department. When I say updating it, it is out there today, but we're updating the terms and references pursuant to what we've seen in the new executive order. So right now, as you know, in order for us to know someone identifies as LGBTQ+, they must self-identify. And I think in past, there may have been some fear in doing so. But we are, we've got Pride Month coming up. We have probably 30 some events I looked at that we are about to roll out. The Secretary is going to be heavily involved in communicating and participating in Pride Month. So I think the department is doing some ambitious things now when it comes to making sure that all people are safe and welcome.
Well, Mr. Johnson, I'd be definitely interested in the ways in which the department can improve its data collection on this group of employees, and hopefully you'll get with your team and strategize those ways. Dr. Elliott, your testimony really concerned me about the resistance that you described at the site level, and I want you to be assured that I will be paying attention to that particular issue. It strikes me that you're describing something that I can find very plausible, and I'll try to engage the Secretary on that question as well. So I want you to know that. Mr. LeGrune, before I close out here, can you tell me what are the arguments they're throwing up, the VA is throwing up in terms of stopping the data from being released? What is the objection or objections, the main ones?
So unfortunately, the VA has not effectively communicated their objections. They've just been unresponsive. And unfortunately, again, these are the measures in which just having a relationship that is more unilateral with the VA would allow us to have the communication necessary to avoid these uncomfortable moments, because by ignoring us, certainly you're sending the message that our request doesn't matter, and therefore the issues that we're bringing up don't matter to the system. So again, I'd love to speak to their objections, but we haven't heard them because we haven't heard anything directly back from the VA.
And can you tell me when, just when your attempts were to get data, when did you submit these requests? When did you ask them for it?
So these FOIA requests were submitted sometime last year by the Black Veterans Project. So we've been waiting for some time. We have engaged some support from other organizations that have allowed us to consider other litigation. Again, these are the steps we're seeking to avoid. So I'm optimistic, cautiously optimistic, that we can have further conversation internally without having to pursue these actions that don't allow us to partner with the VA in a very full manner.
Mr. LeGroux, on a separate note, it wasn't about employees, but I know that my staff has been trying to get data on programs such as the VA home loan and the GI Bill and how it affected minorities since the inception of these programs. And we were unsuccessful in the last administration on obtaining such data. I will pledge to work with you in trying to get better cooperation because this data is of interest definitely to my staff as well. And we definitely want to partner with you in terms of assessing the quality of the data. With that, Mr. Chairman, I yield back.
Thank you, Mr. Chairman.
Well, thank you. And I want to thank all of today's witnesses for being a part of the panel. It doesn't appear that there are any additional questions. Chairman Takano, did you have any closing comments you wanted to give before we concluded the hearing?
Briefly, let me just say I profited greatly from this hearing, Chairman Pappas. I thank you and the ranking member and the staff for bringing all of our witnesses together. To my gratitude to all of the witnesses for providing some very, very insightful and valuable and frank and honest testimony today. Mr. Johnson, I'm glad to see that you've been better resourced. I want to make sure that going forward that you are adequately resourced, making the VA a welcoming place for veterans, the diverse veteran population we have, but also making the VA a place that provides opportunity for all employees of diverse backgrounds, and especially rooting out, whether it by habit or whether it's embedded systemically, we have to undo and dismantle any sort of discriminatory or racist barriers to employee advancement and diversity at the highest ranks of the department. And so with that, Mr. Chairman, I applaud you for the work that you're doing. Representative Spanberger, thank you so much for putting your time in today, and all members of the committee. So thank you very much.
Well, thank you, Mr. Chairman. I'm really grateful for your presence here today. I thought this was a very intriguing conversation. It's an essential one for us to be having. And I left feeling encouraged about what we heard from the VA, which reemphasizes what the Secretary has told us about their commitment to creating a more diverse, inclusive, and equitable workforce. But we know we have work to do. And in the coming months, we're expecting to see VA taking more concrete steps and to lay a sustainable and long-term plan to address the most significant and persistent challenges that we faced and that VA employees face. So, I'm encouraged that VA has taken the steps to hire additional personnel, including Ms. Pugh and EEO counselors to staff needed analytical and employee counseling functions. This is an important start. And I think this hearing brought out many ways for VA to take additional steps forward. And I look forward to working with the department to turn these ideas into reality. It's got to happen. We all agree that a more diverse, equitable, and inclusive VA is both a moral imperative and a business imperative. It's good for people, and it's good for the mission of VA and the veterans that VA serves. So I really look forward to continuing to hear you all out, to partner with you as best we can on our committee. And I want to thank all our witnesses for their contributions to today's conversation and really the long-term conversation that we were having on transforming VA's workforce. I really appreciate your words today. I think that this has been a very, very helpful session. So with that, all members will have 5 legislative days to revise and extend their remarks, including any extraneous material. And today's hearing is now adjourned. Thank you.